A lot of low back and knee pain comes from the underutilization of the gluteus maximus. Now, the gluteus maximus is the largest and most powerful muscle in the human body, and it is innervated by a nerve called the inferior gluteal nerve. When we sit a lot, this nerve gets compressed. This causes, sort of like how your hands fall asleep, your glute to fall asleep. And you might have noticed that when you're trying to get up after having sat for a long time, that can be a little difficult. And it feels weird after the first few steps. And that's partially because your glute has fallen asleep and your brain is figuring out a new way to walk. So what we need is a way to reactivate the glute, reincorporate it into our movement pattern so that we can be free of things like back pain and knee pain. The best way I know of to do that is to simply take a step forward with one leg. Start to bend the knee and place your weight over your lead foot. Now, 3 things are required to make this work. We need to start adducting our hip like so. As we come forward, bringing the hip towards the midline. Second piece is this bone needs to internally rotate. That means it needs to spin this way. But the easiest way to do that is to bring the opposite hip towards the knee. So you can place one hand on the opposite hip and try and bring that hand without moving it off your hip towards the leading knee. You might start to feel some of that tension develop. The final piece is to incorporate hip flexion. That's the closing of this hip angle and allowing your posterior leg, your trailing leg, heel to come off the ground. That way your balance is challenged. You can also bring in some load by raising your hands overhead and some additional twist by moving the arms in different patterns here. The key being that you feel tension, fatigue, and contraction of this gluteus maximus. I hope you found this video useful. Hit me up in the comments and let me know what type of pain you experience. Maybe I'll make a video about it.